Antimicrobial resistance (AMR) is a pressing global health and socio-economic crisis that has had significant impacts on human and animal health, food production, and the environment. The launch of the AMR Awareness Week, commemorated annually from the 18th to 24th November, highlighted this year's theme that calls on the global community to educate stakeholders on AMR, advocate for bold commitments, and take concrete actions in response to AMR.
When you talk about antimicrobial resistance, it means that these organisms are now resistant to the drugs that we use to treat them. And I think that's what we're going to listen to today, so that we improve our understanding of how does this develop.
The government of Kenya, through its state departments of health, environment, agriculture and livestock, mining and blue economy, and the University of Nairobi, has joined the global community that aims to educate the public about the effects of AMR, its prevention and control.
So antimicrobial resistance is a problem because we stand at the risk of losing all the gains that we have already made in terms of modern healthcare. We run the risk of having infections that are not treatable, having healthcare costs that are spiraling, and even increased rates of mortality across the population.
The panelists in a press briefing attributed the root cause of the AMR silent pandemic to negligence in hospitals and unprofessional prescription that has increased improper handling of antibiotics, antivirals, antifungals, and antiparasitics.
So if you're sick and you keep going to a pharmacy to pick antibiotics, if you're sick and you take antibiotics that have been left over, if you don't finish your doses of antibiotics, then you're placing yourself at risk of having bacteria that are resistant to antibiotics.
By 2050, AMR is projected to play a role in 8.22 million AMR-associated deaths, an increase of 75% from 4.71 million deaths in 2021.
Right now, as you can see, I'm a person living with permanent disability thanks to AMR. And this was because after I got a hospital-acquired infection, then, and this was multi-drug resistant. It was very difficult to treat it. And when eventually managed to treat it, it's unlikely that I want to go back to that surgery. What
can be done to tame this silent pandemic that is jeopardizing the government's effort in providing a universal health care?
We must use antibiotics properly. For human health, for human beings, let us stop picking antibiotics over the counter and just taking without having a proper diagnosis and knowing that we truly require the antibiotics.
We need to observe high levels of cleanliness at the farm level and also ensure that our animals are properly fed.
The Awareness Week provides a window of opportunity for political, social, and financial commitments to increase accountability in response to the AMR pandemic. Reporting for UNC-TV, Dennis Omonti.
UNC-TV, empowering you.